Hi there, my name is Dr. Kane Treble and welcome once again to Long Consult. I wanted to cover today the topic of hypertension or high blood pressure. It's a really common presentation and something that I think we probably don't explain overly well as to what it actually is, what causes it, and why do we actually care about it in the first place. So I'll try and keep it short and sweet. Here we go. High blood pressure, if you picture our blood and circulatory system as kind of a tire tube, high blood pressure is where the pressure inside that tube is too high. Why do we care about it? Well, just like if a tyre is kept at too high pressure, it increases the chances of things popping. Our blood vessels are only designed for so much wear and tear, and having that additional strain not only affects the blood vessels themselves, but all of the organs in the body that those blood vessels supply. And that's everything. So what actually causes it? Well, this gets a bit more complicated still, because this can be just general wear and tear on the cardiovascular system, so the heart either not pumping properly or efficiently enough, or perhaps even too efficiently. It can be wear and tear on the blood vessels due to stiffening or atherosclerosis over time. It could be from the kidneys not adequately responding to the amount of fluid levels in the body, or the endocrine system, so it's the hormonal system of the body, whether there's signals floating around that are causing the blood pressure to be the way it is. You can also have neurological causes of blood pressure where the brain is stimulating things to cause the blood pressure to elevate. And of course, there's psychological. One of the common things we see in general practice is white coat hypertension, which is where when you come into our practice, we take your blood pressure and it's high. But if we were to check it day to day, it'd probably be within the normal range. There's a few ways we can find out if that is the case. So if you think that might apply to you, have a chat to your GP. As for why do we treat it? Well, I don't like the idea of tire tubes popping inside my brain. That would be what we call a stroke, and it's generally a bad thing. But fortunately, there is lots we can do about it. But what we do really depends on the underlying cause. The most important thing, and probably the hardest thing to really do, because we're all pretty bad at it, is implementing proper, sustainable diet and lifestyle changes. Dirty words, I know, but they can make massive, massive differences. The number of people who've been able to successfully implement these changes and come off of medications is dramatic and noteworthy. It does take willpower, it does take a sustainable change, so don't go out there thinking you're going to fix everything in one go. And for more tips and tricks on that, I recommend you have a chat with your GP about what's the best and safest way for you to go about that. But of course, we do have medications, and lots of medications aim for this, being such a common and well-studied problem. Now, as for which medication is going to be the right one for you really depends on your underlying cause of high blood pressure. And we really want to target each of those different systems that might be involved, and the way we'll do that will differ from case to case. Not only that, but other medications you're taking may interact with different blood pressure medications, and so we want to make sure that that's the right one for you. Have a chat to your GP today, or just get your blood pressure checked. I think it's something that we can really do lots of work on, but the first step is knowing that it's there. Thanks for tuning in, and I hope you found that helpful. Now, none of this content is monetized. I make no money from doing it, but I want to keep making it to get this kind of information out there to people just like you. If you found this helpful, something you could do to help me would be to like, comment and subscribe on YouTube, to leave a 5-star rating and review on iTunes, visit our website at longconsult.com.au, or share this to your social media page to help spread the word. I pay no money for advertising, and so the only way this reaches people is if you share it along. Thanks for your help, and I will catch you at the next Long Consult.